Ever wondered what hepatitis B is and why it's such a big deal in the world of public health? Well, let's dive right in. Hepatitis B is a formidable adversary. It's a virus, but not just any virus. This one specifically targets your liver, the organ responsible for filtering your blood and detoxifying chemicals in your body. Once hepatitis B invades, it can cause both acute and chronic disease. Acute hepatitis B is a short-term illness that occurs within the first 6 months after someone is exposed to the virus. Chronic hepatitis B, on the other hand, is a long-term infection that strikes when the virus remains in a person's body. Now, why is this a big deal? Well, hepatitis B is a major global health problem. It's potentially life-threatening and can lead to serious conditions like liver cirrhosis or liver cancer. So it's clear that hepatitis B is not to be taken lightly, but how does one treat it? Treatment for hepatitis B is not a one-size-fits-all, and it depends on various factors. It's essential to understand that each individual's treatment plan is unique, tailored to their specific circumstances and medical needs. When it comes to hepatitis B, several factors determine the course of action. The severity of the disease, for instance, plays a huge role. If the disease is in its early stages, the treatment may be different compared to a more advanced stage where the liver is significantly damaged. The age of the patient is another determining factor. Younger patients may have different treatment options than older ones, as their bodies can react differently to the disease and potential treatments. Lastly, the overall health of the patient is crucial. If someone has other health conditions, these need to be taken into account, as these can influence how the body responds to hepatitis B treatment. There are two main types of treatment for hepatitis B: antiviral medications and interferon injections. Let's talk about how they work. Antiviral medications are commonly used in the management of hepatitis B. They work by slowing down the virus's ability to replicate within the body, which helps to reduce inflammation and prevent further damage to the liver. Interferon injections, on the other hand, are a form of immune therapy. They boost the body's immune system to fight off the virus more effectively. This type of treatment is often used for patients who have a more severe form of the disease, or when antiviral medications aren't as effective. It's important to remember, though, that these treatments aren't a cure. They are tools to help manage the disease, slow its progression, and prevent complications. They can make a significant difference in the quality of life for those living with hepatitis B, but they don't eradicate the virus from the body. With this understanding of hepatitis B treatment, you might be wondering about the key takeaways. So what are they? Now that we've taken a deep dive into hepatitis B and its treatment, it's time to summarize the main points. First and foremost, hepatitis B is a serious liver infection caused by the hepatitis B virus. This pesky intruder can lead to both acute and chronic diseases, threatening the health of millions of individuals worldwide. It's a silent invader, often showing no symptoms until it has caused significant liver damage. The treatment of hepatitis B is a complex process that depends on various factors, such as the stage of the disease, the age of the patient, and the overall health status. The aim of treatment is to control the virus's replication, minimize liver damage, and reduce the risk of complications like cirrhosis and liver cancer. When we talk about treatment, antiviral medications and interferon injections are the main types of treatment. Antiviral drugs like tenofovir and entecavir are often used to slow down the virus's replication and reduce its impact on the liver. Interferon injections, on the other hand, boost the body's immune system to fight off the virus. However, it's important to note that these treatments help to manage the disease but do not cure it. In other words, they help to keep the virus at bay and mitigate its harmful effects, but they do not eliminate it from the body. That's why continuous monitoring and regular follow-ups are crucial for individuals living with hepatitis B. Lastly, it's worth mentioning that prevention is always better than cure. Vaccination against hepatitis B is highly effective and is the best way to prevent this infection. Remember, knowledge is power. Understanding hepatitis B and its treatment can help us make informed health decisions and hopefully contribute to a healthier world.